Prioritization and targeting. So as I said before, we have been allocated about 21,600 doses. We've received 2,000 doses last week. And so at present, we have coverage for approximately 20% of our population. And so we are going to have to prioritize and target the priority groups in the initial stages. And so the National Immunization Committee would have met and determined the target groups for the various stages. And so we will roll out this plan in 3 stages: stage 1, stage 2, stage 3. And I will give you an overview of the priority groups in each of these stages. And so in stage 1, we have stage 1A, healthcare workers who are working in the front line. This includes all the specialists, internists, doctors and nurses working on the COVID-19 wards, St. Kitts and Nevis, the operating theaters in both islands, ICU, emergency room, and all the nurse managers and the nurses who go and take samples at various quarantine sites and at the hotels, and also the personnel working on the ambulances. Stage 1B includes the border protection staff working on the front line along the corridor of containment. So this includes port health staff, immigration, customs, ground transportation, and hotel workers on the front line. Stage 1C includes the executive arm of government and essential workers outside of the health sector. And these include police and defense force, coast guard, fire and rescue. We will also look at or target older adults with chronic diseases, meaning those chronic conditions that places them at higher risk for severe COVID disease. So that means older adults with diabetes, respiratory conditions like emphysema, asthma, renal disease, and autoimmune conditions and coagulopathies. We are also advised to have an emergency reserve of vaccines for utilization in the case of an outbreak, meaning clusters or even community spread. So these are the target groups for the first phase of our rollout of our COVID-19 vaccination. So in terms of stage 2, I'm going to describe the priority groups in the second stage. Healthcare workers who are at moderate to high risk, and these include those working in nursing homes and home care services, laboratory staff, etc. We are also targeting older adults with no or one comorbidity. We are also looking at persons under 60 years of age with chronic diseases, so that the middle age group with chronic diseases. And then we are also going to be targeting socioeconomic groups, including low-income migrant settlements, disadvantaged persons registered in the Social Security benefit systems, persons with disabilities, low-income groups, hard-to-reach populations, and persons with mental disease. So these are the target groups for stage 2. Stage 3, we will be targeting all the staff and teachers in the Ministry of Education from the early childhood phase to the tertiary level. And then we will also target essential workers outside of the health system. And these include municipal services, other civil servants, persons working in agriculture, the food industry, ground and sea transportation, etc. We will also target social employment groups like prison workers and residents, persons working in the manufacturing industry, persons at New Horizon Detention Center, Children's Home, and the offshore medical school dorms. We are going to also include all other persons in the society in this phase or in stage 3. And so this would include all our young adults and middle-aged adults who may not have any chronic illness. And so based on the target groups I would have described, everybody in our society would be covered. At present, the Ministry of Health is collaborating with the IT department in developing a registry which will be populated with the names of the individuals in the various target groups I would have just described. And we are also developing a database whereby we will be able to monitor vaccine safety. So in other words, once you would have received your COVID-19 vaccination, we are going to follow you up for a minimum of 3 months. So it's going to be 3 months and more, just to make sure you, or to capture any of the side effects that you would have experienced having received the vaccine. And we are going to capture this data in our database. Now, once you would have received the vaccine, you will be issued a COVID-19 vaccination card. And so once you've gotten your first dose, your card would state dose 1, date, you will be given an appointment for your second dose. Once you would have returned for your second dose, it would be recorded, and so your vaccination card will be given to you, and so you can use it as needed. The Ministry of Health has also developed a comprehensive communication strategy. And this is important because we must inform the public, educate the public about this vaccine. And education and communication of this nature precedes any rollout of any vaccine. And so it's our job to provide you, the general public, with the facts as we know it about COVID-19 vaccine. We will provide you the facts such that you can make an informed decision and accept the vaccine. We intend to use the traditional media and digital media platforms. And I want to use this opportunity to invite volunteers, advocates who want to work with the task force and the Ministry of Health in staging an effective public education campaign about COVID-19 vaccine. We cannot do this alone, and so the task force and the Ministry of Health, we want to engage the key stakeholders, meaning those within the government and those outside of the government, in the private sector, NGOs, civil society organizations, to come on board. From last year to present, we've used an all-of-society approach in our response to COVID-19, and it continues. And so we need your help in order for us to successfully roll out this COVID-19 vaccine campaign. And in order for us to be successful in achieving the herd immunity threshold, we need all hands on deck. In terms of the regulatory framework, we are collaborating with the Attorney General's chambers in making sure all the T's are crossed and all I's are dotted in terms of our regulatory framework. And of course, we can't accomplish much without adequate resources and funding. Okay, so